Hello everyone, my name is Dalia and I hope everyone is a healthy and happy. Today inshallah we will talk about an important topic which is how to evaluate or how to assessment the abdominal injury because the abdominal is a most organ can be affected maybe blunt trauma, and this video inshallah we will talk about how what's the four technique to assessment of abdominal injury. Before we start explaining the topic, we should know the regions of the abdomen. It can be of 9 or 4 section. Okay, this picture describes the 9 section. As we see, the right side and the left side. In the right side, we can see hypochondriac region and right lumbar region and the right iliac region. In the left side, hypochondriac region, left lumbar region and the left iliac region. In the middle side, epigastric region, umbilical region and hypogastric region. We can divide the abdomen into the four regions. This picture describes the four quadrant region of abdomen, the right upper quadrant and the right lower quadrant, and in the left side, left upper quadrant and the left lower quadrant. Let's start to talk about how to examine the abdomen. There is a four technique. The first one is inspection, then the auscultation, then the percussion, and the last one is palpation. But before you know these four technique, you must know the history, which means you should to collect data to know the person, how the mechanism of injury, maybe blunt trauma, maybe penetrating in trauma. So the history is important thing. And in some special cases such as falling down, we know the head injury or spinal injury do the masking of abdominal injury. So the history is a important thing to know. Then the physical examination that we consist of the four technique, as we say: inspection, auscultation, and the percussion and palpation. This finding, whether positive or negative, should be documented carefully in a medical record. Let's start of the inspection. Inspection means observation, and the patient should be undressed and do head to toe examination. The means of that, you should to start of the chest and then the abdomen, because the chest may be affected on the abdominal injury, and then inspection the perineum area and notice any laceration, the percussion, contusion, penetrating wounds, and then the patient can be continuously long rolled to facilitate to complete examination. The second is the auscultation, means auscultated a bowel sounds present or absent. Presence means it's a normal condition and the normal structure, but absence means the blood or pressure inside the abdomen that you should notice to that, and maybe produce the ileus. Ileus means paralysis or absence of bowel sound. Okay. Ileus also may occur from extra abdominal injury, ribs, spine, and the pelvic fracture. The third technique is a percussion. The percussion is a less used one, and percussion means do the slight motion with a middle finger and notice to the rebound tenderness. Rebound tenderness means when put the hand and increase pressure, relieve the pain, and when remove the hand, return the pain. And this signs of the appendicitis. Okay. This maneuver generates the slight motion and the peritoneum and produce a response similar to asking the patient to cough. Means of this statement, when increase pressure into the abdomen, the person stimulate to the cough. Okay, the last one is a palpation. Why the palpation is a last one? Because if we do in the first things, palpation may be it change the organ site and it change the data that you should be documentation. Okay, palpation, any touch to the patient consider a palpation, and there is two type of palpation: superficial and deep palpation, and we started with superficial palpation. In this technique, we want to see where the pain and how much of severity and the magnitude mean the radiation of the pain. But the pain, if they're from inside or the visceral, the patients is difficult to description the characteristic of the pain. There are two things: voluntary tensing and involuntary muscles guarding. Voluntary tensing mean the patients in a voluntary reaction and voluntary movement to do the muscles contraction to prevent you to entering your hand to do the assessment. Maybe the patients is a fire and so on. But involuntary muscles guarding, this is an involuntary. Maybe the patient is conscious or unconscious, but if their signs present, this is a best indicator there are presence of peritoneal irritation or peritonitis. Do the fourth technique of abdominal assessment. We do the rectal examination. Means or digital rectal examination means insertion your finger to the anus to detect any abnormal condition such as a blood, maybe indicate bowel perforation, and to the ascertain sphincter stone to assess spinal integrity. Okay, and after a blunt trauma, the rectal will also should be palpated to detect the fracture, bony elements, and prostate position. The digital rectal examination do for any condition, maybe for any condition, either the medical condition or the traumatic condition. Medical conditions such as a high riding prostate or meanings enlargement of prostate, or traumatic condition such as the urethral disruption. Then do the vaginal examination. Vaginal examination, laceration of the vagina may occur from penetrating wound or bony fragment from the pelvic fracture, and should do this examination with gloves and put the lubricant to make the easily examination. Then examination of the penile for the male. Laceration of the urethra should be suspected if blood is present. Cause a bleeding or positive physical examination means a significant intra-abdominal trauma. But negative physical examination does not mean no have a trauma, or if the clinical signs not clearly appear, we cannot able to do excluding the trauma. Okay, for many patients, abdominal examination may not be diagnostic before of the confounding factor or early absence of clinical signs that may become obvious during subsequent examination. After to take a history and collect data and do a physical examination, you should to do more specific things such as nasogastric tube to know if there are blood inside the stomach or the no, and do the catheter insertion and do the blood sampling and x-ray to detect the more specific diagnosis. In the last lecture, I love to thank you, and I hope you understand the lecture, and I wish you a happy day with full activity and peace, and thank you again.